Welcome everyone to my webinar today on reducing the risk of breast cancer. I'm so glad you're here, whether you're viewing this live or you are viewing the recording. So welcome, and let's go ahead and get started. So again, I am going to be talking about reducing the risk of breast cancer. It's up to you. And everything that I say on reducing the risk of breast cancer also pertains to other cancers. It pertains to heart disease. It pertains to Alzheimer's. It pertains to hypertension, to all of the major killers that are shortening the lifespans of Americans. So let me first give you a little bit of information about my background. I'm an oncologist. My specialty is breast cancer. And I started practicing in 1983 after I finished my training at Washington University in St. Louis. And I loved every minute of my practice. I would do it again in a heartbeat. But as time went on, I started to see younger and younger women with breast cancer. So initially, they were women that were my age, in their 50s and older. And then they were in their 40s and 30s and 20s. And so I became really emotionally attached to the young women. They would come in with their babies and their toddlers and their young children. And I just was obsessed with making sure that these women did well so that they could live and raise their own children. And I knew that in helping these women get well, it was so much more than surgery, chemotherapy, and radiation. So we're going to explore that as we go on in this talk. So just how big is breast cancer? It's the most common cancer in women worldwide. And every single year, over 270,000 new cases of invasive breast cancer are diagnosed. And every year, about 42,000 women die of breast cancer. So there are a lot more women living than dying, because in the United States alone, we have almost 200 million survivors of breast cancer, and that's a good thing. So in a given year of breast cancer diagnoses, if we follow those women 5 years, the survival rate is 90%. So most women with breast cancer do well, they're cured, and they go on to live a long, healthy life. What about men? We do see breast cancer in men, but it's very rare. So each year we see about 2,600 new cases of breast cancer and about 500 deaths. So there are 3 risk factors that you cannot change with regard to breast cancer: being female. So overall, in our lifetimes, we have a 1 in 8 chance of developing breast cancer. Now, that doesn't mean that we wake up every morning and we have a 1 in 8 chance of developing breast cancer, or by Christmas time, we'd all have breast cancer. So let me explain further when I get to age. As we get older, our risk of breast cancer increases. So if we look at the table to the right, a woman who is 20 years of age has a 1 in 1,400 chance of developing breast cancer. When she is 30, a woman who is 30 has a 1 in 200 chance of developing breast cancer. By the time that woman is 50 years of age, the risk of developing breast cancer is 1 in 42. And the highest risk is seen in women in their 70s. So if you are 70 years of age, you have a 1 in 25 chance of developing breast cancer. So overall, your lifetime risk is 1 in 8. What about family history? If you have a first-degree relative, a mom, a sister, or a daughter with breast cancer, then your risk of developing breast cancer is double the normal population. So genetics are most breast cancers as a result of genetics. Well, let's look at the 2 most common breast cancer genes, and those are the BRCA genes, 1 and 2. The BRCA genes actually afflict less than 1% of the general population, less than 1%. So in terms of breast cancers, only 5% of breast cancers are attributable to the BRCA genes, only 5% of breast cancers. But if you are a BRCA gene carrier, then your risk of developing breast cancer is significantly higher than the normal population. So by age 50, a BRCA gene carrier has up to a 50% chance of developing breast cancer compared to 2% of the normal population. By the age of 70, that risk of developing breast cancer is as high as 87% compared to 8% of the normal population. And the other important factor is that of ovarian cancer. If you're a BRCA gene carrier, then your risk of developing ovarian cancer is as high as 44% by the age of 70. So these are important genes to know about. However, the empowering thing is that we can turn genes on or off depending on our diet and our lifestyle and other environmental factors. So for example, if you have a genetic predisposition to cancer and you choose to smoke, then your probability of developing a smoking-related cancer increases dramatically. If you choose not to smoke, then what you're doing is actually turning those genes off. And the same thing for exposure to chemicals, asbestos, lead, other pollutants. We have control over the stress in our lives. Sometimes we feel that we don't have control, but we do. And I'm going to talk about it more towards the end of the talk. So what happens with stress? It increases cortisol levels, it increases insulin levels, and that can predispose us to some of the chronic diseases. And then the same thing for diet and lifestyle. So are you at risk for a genetic mutation? You can find out with some of the tools that are available. And this is one such tool. It's an online store where you can purchase a saliva test for $239. pinklotus.com is the website. The kit arrives at your home, you spit into a tube, you mail it back to the company, and within a few weeks, you have an analysis of 30 different genes, including the ones for breast cancer. And this kit comes with a genetic counselor to decipher this information for you. So if you're worried, this could be a great tool for you. So if it's not our genes, then what is it? Let's talk about Japanese and Chinese living in their homeland, where the incidence of breast cancer is extremely low, at least prior to the 1990s. Breast cancer in Japanese and Chinese living in their homeland was very low. However, when they emigrated to the United States, the incidence of breast cancer increased 100%. in just one generation. So what happened to these Japanese and Chinese immigrants? What happened is they adopted the American lifestyle. They became more sedentary. They started eating fast food. They started eating junk food. They gained weight, and hence the increase in breast cancer. So let's look at the cancer risk factors that you do have control over, those that you can change. Overweight and obesity. It may be difficult to get to a healthier weight, but you do have control over this. Alcohol consumption, you do have control. Whether you exercise or not, whether you choose to undergo hormone replacement therapy, because women who have hormone replacement therapy have a slightly higher incidence of breast cancer. You can change your stress. We all have stress in our lives. We can change how we react to stress. We can oftentimes change environmental toxicities. We can filter our water, for example. We can choose not to drink from plastic bottles that can leach harmful chemicals and so forth. But what happens 3 to 6 times a day, is the most important thing that we can do to reduce our risk of cancer and other chronic diseases, and that is eating. So if you look at the picture on the left, that's the standard American diet, the burgers, the processed meats such as hot dogs, the pizza, the fried foods, the platter of French fries, all of these unhealthy foods that are not nourishing our bodies. On the right side, we see these beautiful fruits and vegetables, chock full of nutrients that help us with our health and well-being. So food is medicine. We absolutely know that. So how does unhealthy food promote cancer? Unhealthy foods can raise estrogen levels, and we know that 80% of breast cancers are fueled by estrogen. Unhealthy foods also promote growth factors, which cause cancers to grow and cells to mutate. Cancers cannot grow beyond a certain size, or they cannot spread to other organs within the body without developing their own blood vessels. And so unhealthy foods promote angiogenesis, or blood vessel formation. Unhealthy foods result in inflammation to the body, in free radical formation that are harmful to our cells. And they also wreak havoc on our immune system. So cancer is either choked or stoked by the food we eat. So let's look at the root causes of chronic disease. There are 2 root causes: a decrease in blood flow, such as heart disease, stroke, and Alzheimer's. And just a word about Alzheimer's, because heart disease is the disease that is responsible for the most deaths in both men and women in the United States. But many of us fear Alzheimer's more than we fear heart disease. Alzheimer's is the same disease process as heart disease. It's a decrease in blood flow from clogging of our vessels with fat and cholesterol. So the same process that happens in the heart can happen in the brain, and both can be prevented, both can be improved. So the other root cause of chronic disease is inflammation. And examples of diseases as a result of inflammation are cancer and autoimmune diseases such as multiple sclerosis, Crohn's disease, lupus, rheumatoid arthritis, and psoriasis. So healthy foods are chock full of thousands of phytonutrients, plant chemicals that, again, create a healthy environment for our cells and our tissues and our organs that actually fuel all of the tissues in our body. So what are some of these plant chemicals, these phytonutrients that are so important? This is a short list, of course, for curcumin, found in the spice turmeric, resveratrol, found in red grapes and red wine, omega-3 fatty acids in flax seeds and avocado, procyanidins in berries, genistein in soy, lycopene in tomatoes, anthocyanidins in apples. So let's look at lycopene. Men who consume tomatoes have a lower incidence of prostate cancer. And if they've already developed prostate cancer, consumption of tomatoes, whether they're fresh tomatoes or tomato sauce, or pasta sauces made with tomatoes, provide the phytonutrient lycopene, and those can improve outcomes in men with prostate cancer. So if you want to defeat cancer, eat like you mean it. So here are the top 10 superfoods for breast, and these are also superfoods for really any organ in the body, for our bodies in general. Soy. Yes, soy is a superfood, and I'm going to spend some time talking about that because I get phone calls and emails and text messages about soy every single week. Women who are fearful of soy, who have been told that soy caused their breast cancer, and nothing could be further from the truth. Cruciferous vegetables, superfoods, broccoli and cauliflower, for example, berries, apples, tomatoes, mushrooms, turmeric and other spices, ground flax seeds for those omega-3s. So for the flax seeds, you have to grind them in order for them to be properly absorbed. So 1 to 2 tablespoons sprinkled in your oatmeal or in a smoothie, really important for general health and well-being. And then that whole category of plants that includes garlic, onions, leeks, shallots, chives, and scallions. And then adding dietary fiber is important. If you look at a really easy source of dietary fiber, 3 stalks of celery, 15 calories, only 15 calories, with wonderful fiber that can be so beneficial. So let's look more closely at breast cancer risk factors. Overweight and obesity increases our risk of breast cancer as much as 2 times above the general population, as much as 2 times higher risk by being overweight or obese. Lack of exercise results in a 25% higher incidence of breast cancer. Drinking 2 to 3 alcoholic beverages a day increases our risk of breast cancer by 20%. So we have control over all of these things. So why is weight a risk factor? Weight is a risk factor because of estrogen dominance. When we have excess weight on our bodies, that results in higher circulating estrogen levels, and that's the precursor for breast cancer. Fat, our own body fat, is the largest source of estrogen in postmenopausal women. And the same is true for uterine cancer. We almost never, I don't think I've ever seen one single patient with uterine cancer who was not overweight or obese. So getting to a healthy weight is really important. So 40% of all the cancers we see are as a result from obesity, 40%. And so each year that translates into over 600,000 new cases of cancer every year. What are those obesity-related cancers? Uterus, ovary, breast, prostate, colon, rectum, liver, stomach, pancreas, gallbladder, esophagus, thyroid, kidney, myeloma, and meningioma. A huge laundry list of cancers related to obesity. So let's move on to the topic of sleep, because this is one of my favorite topics. When I was raising my children and working like a maniac, I thought sleep was a waste of time. If I could get by on 4 hours of sleep, why in the world would I want to sleep 7? And so I was sleep deprived a lot when I was working full time. And so what happens during sleep? Well, first of all, melatonin is a hormone that is secreted to help us fall asleep. And melatonin peaks at about 2 a.m. Melatonin not only helps us go to sleep and keeps us sleeping, but it inhibits tumor growth and development. So the brilliance of the human body, a hormone that helps us fall asleep, but that same hormone inhibits tumor growth and development. Night workers, those nurses that work the night shift, have a 40% increased risk of breast cancer. So that light at night when we should be sleeping disrupts melatonin. And also that light from the television in our bedrooms, or that computer on our lap, or our cell phones disrupts melatonin and interferes with sleep. Sleep is restorative. Oh my gosh, so many amazing things happen when we're sleeping. Cells are repaired, tissues and organs are repaired. Our immune system is enhanced and made stronger. So we want to sleep about 7 hours if you're female, 8 hours if you're male. Really important habit of health. So let's talk exercise. There are so many studies looking at lifestyle and breast cancer. So this summary of 70 different studies showed that women who exercise increase their survival from breast cancer by 40%. A 40% increase in survival simply by exercising. So what happens during exercise? We lower circulating estrogen, we reduce stress, we reduce cortisol levels, we increase our blood flow, we enhance our immune systems. So many positive things happen from exercise. Now, do we have to train for an Ironman or a 5K or a marathon? Absolutely not. It's walking 30 minutes a day and working up a bit of a sweat. Just 30 minutes a day of walking creates all of these positive survival benefits. So let's talk alcohol. Alcohol has been classified as a breast carcinogen. So for breast cancer, no amount of alcohol is safe. Even 1 drink a day has been shown to have a small increase in the incidence of breast cancer, with the exception of red wine. Women that drink 1 glass of red wine, they don't have to drink it every day, but 1 glass of red wine has not been shown to increase the risk of breast cancer. And the probable reason is because of the substances in the skin of those red grapes, that resveratrol, that suppresses estrogen production. But I didn't say drink the whole bottle. It's 1 glass, and that should be about 4 ounces, certainly not more than 6 ounces. So let's talk soy, because again, every single week, sometimes every day, I get people that reach out and ask about soy. Most of them are fearful of soy, but here's a really large study that was published from data of American women. So soy intake in over 6,000 breast cancer survivors. And those who consume soy had a decreased death rate from any cause, 21% lower death rate from any cause as compared to women who did not consume soy. So what do I mean by any cause? A decreased death rate from cancer, from heart disease, from diabetes, from stroke, from hypertension, from any cause that shortens lifespan in Americans. So very powerful. 14 other studies of breast cancer survivors showed that these survivors live significantly longer if they consume soy. They had a lower risk of cancer recurrence and lived significantly longer. And that was the equivalent of 1 cup of soy milk a day. 1 cup of soy milk a day translated into a 25% lower recurrence rate. So don't be afraid of soy. It's actually a superfood. So final thoughts on soy. Soy foods prevent cancer. They benefit women who have already been diagnosed with cancer. And genistein is that phytonutrient in soy that interferes with cell growth and proliferation. So it actually suppresses cell growth and proliferation. Also, soy helps to prevent hypertension, diabetes, heart disease, and other chronic diseases. And consuming soy as a child before puberty offers the best protection against all of these diseases. So let's get our children switch from cow's milk to soy. So let's talk meat and dairy. The China study was published in 2005. And so I read it about 15 years ago, and it changed my life. It changed the way I practiced. It changed the food that I ate. It changed the food that I fed my children. And this is one powerful message from the China study. Blood cholesterol is a strong predictor of cancer risk. As cholesterol levels decrease, cancers of the liver, rectum, colon, lung, breast, stomach, and esophagus decrease dramatically. So high cholesterol levels are not just a predictor of heart disease and stroke, but they're also a predictor of a lot of different cancers. By lowering your cholesterol levels, by eating less meat and less dairy and more fruits and vegetables, we can decrease our risk of some of these major killers rather dramatically. So eating more plants is really the answer to creating vibrant health and longevity. So this study of 1,500 women with a diagnosis of breast cancer, those women that ate 5 or more servings of fruits and vegetables every day and walked 30 minutes a day, 6 days a week, had a 50% higher survival than the women who consumed less fruits and vegetables and did not exercise on a regular basis. Easy things that we can all do. So you can do it. You can eat more fruits and vegetables and less meat and dairy. You can walk 30 minutes a day and drink mostly water and tea. You can sleep 7 to 8 hours a night and achieve a healthier weight. We all can do it. These are simple measures. And if you're struggling with weight and that's been a hardship for you, then reach out to a health coach. I'm a health coach, and lots of health coaches are watching this talk. So reach out to a health coach for help with getting to that healthier weight, with help on eating better, with help on engaging in healthy habits such as exercise and hydration and sleep. So this is my recipe for a healthy and happy life. And I'm going to use this acronym, Be Selfish. And I want you to be selfish in your own life, because especially as women, we're always taking care of everybody else before we take care of ourselves. And it's important to do self-care, to take care of yourself first before you take care of others, so that we have the stamina and we have the health and we have the energy to take care of others. So this acronym, selfish, the S stands for spirituality, prayer, meditation, yoga, gratitude. The E stands for exercise. Can you walk 30 minutes a day, 6 days a week? Of course you can. And I tell my patients and my clients, set your phone alarm and for 15 minutes and walk out your door 15 minutes away from the house and then walk back. There's 30 minutes. We all can do that. Love is for the L. Love, love, and love. Love your life. Love the things that you do. Love the people that you encounter. So many people and so many things to love. The F stands for food. Eat healthy food, mostly plants. The I stands for intimacy. And I don't mean sexual intimacy. I mean intimacy in your relationships with your family, your friends, your neighbors, your coworkers. And if you don't have a pet, people that have pets are some of the happiest people on the planet. Their pets love them unconditionally, and you can love them back. So pets, especially, go to a shelter and adopt some of the beautiful pets that are there. The S, the other S stands for sleep. 7 to 8 hours of sleep every night heals our body, repairs those cells, repairs those tissues, those organs, enhances our immune system, and add some humor to your life. Laugh and have fun and eat a little hummus with some carrot sticks and celery sticks while you're at it. So that's my recipe for a healthy and happy life. And I'm going to end here. When I work with people, when I was working with patients, and now that I'm working with clients as a health coach, I oftentimes would hear from women saying, well, I really can't do that. I can't eat more plant-based because I have kids and they like their snacks and they like their burgers. However, children can eat better. They can learn all of these things that I just reviewed. We can be the examples to our family. So make your children and your grandchildren your reason instead of your excuse. So as I look at these two photographs, the babies on the right are my children when they were young. And my heart just goes out looking at that photograph. And now they're the wonderful, amazing young people on the left side. So my son in the middle just got married a few months ago, and he finished his medical training. He's now a practicing surgeon as of August of 2021. My son on the right is an engineer, lives in Houston. He just got back from a stint in Saudi Arabia. My daughter works in financial services. They're just wonderful human beings. And I know that healthy nutrition and healthy lifestyle habits helped create these amazing human beings. So talk to the person who invited you. Share this video with others that you love and care about. And again, if you need help with your own health, especially getting to a healthy weight and adopting that healthy diet and lifestyle, reach out to a health coach. There are thousands of us around the country, and we can help. So thank you so much for coming and listening to this information. I hope that I added value to your day, and go out and take care of you, and then you can take care